For many years now we've been using telehealth to monitor chronic disease and wellness in the community. When COVID became such a worry for Australia, what we decided to do was to adapt our existing telemonitoring solutions to remotely manage COVID positive patients in their homes. So these patients, they were self-isolating in their homes, but they were worried about their disease. We rapidly purchased many thousand pulse oximeter devices. And what happens is we have public testing clinics throughout Australia, and when the COVID positive results come back for those patients, we interact with them totally at a distance, remotely. So we send to their homes physiological monitoring devices such as pulse oximeters, and we deploy on their phones the app, and then we take them through a sort of a training program so that they're comfortable with the measurements they're taken. From our COVID monitoring, we can see when patients are starting to become unwell in their home. So for instance, we take daily questionnaires and we also take routine pulse oximetry measurements. So we can see when they're desaturating, so when their oxygen saturation levels are falling, and that along with some of the other physiological parameters such as temperature allows us to monitor and manage those patients in their homes and predict if they were going to have exacerbations that would require them to go to hospital. In our back-end system, we have a decision support system that looks at the trends in parameters, it looks at thresholds and rates of change, looks at questionnaire responses and what's called in Australian parlance between the flags. So that refers to surf lifesaving. The safest place to be is between the flags when you're swimming at the beach. It's a similar thing with our monitoring. We look at these parameters and we make sure the patients are between the flags and safe. We did this in a very rapid turnaround. Indeed, it took us 6 weeks to develop the app, take some of our wearable devices through our regulatory authority, which is called TGA, which is like the American FDA, and to start monitoring patients throughout Sydney, and then after that, more recently throughout Melbourne.